ओम धम धन्वंतरे नमः। कर्पूरगौरम करुणावतारम संसारसारम भुजगेन्द्रहारम सदा वसंतं हृदयारविंदे भवं भवानी सहितं नमामि. Let me share. Today's topic is CT scan of the chest study. CT scan means the study of the body parts in slices. So, chest is studied here. The film of a CT scan of the chest has different levels. You can see the structures of the chest as slices of the body. Computed tomography, more commonly known as CT scan, is a diagnostic medical imaging test. Like traditional X-rays, it produces multiple images or pictures of the inside of the body. A CT scan generates images that can be reformatted to multiple planes. It can even generate three-dimensional images. The doctor can review these images on a computer monitor, print them on film or via a 3D printer, or transfer them to a CD or DVD. Now let us see the uses of CT scan of the chest. In which conditions CT scan is indicated. It is used to examine abnormalities found on chest X-rays. It helps to diagnose the causes of signs or symptoms of chest disease, such as cough, shortness of breath, chest pain, or fever. To detect and evaluate the extent of tumors that arise in the chest, or tumors that have spread there from other parts of the body. That means primary carcinoma of the lungs, etc., bronchogenic carcinoma, and also secondaries in the lungs by hematogenous spread, like malignancies in the lung parenchyma. To assess whether tumors are responding to treatment. That means we are giving chemotherapy or radiation therapy, then we are repeating the CT scan. So to assess the effect of or outcome of the therapy also can be done by repeated CT scan of the chest to help plan radiation therapy and to evaluate injury of the chest, including heart, blood vessels, lungs, ribs, or spine. Suppose there is history of trauma, you can assess the injury of you can assess the extent of injury to the organs. So this is a film of CT scan of the chest. You can see at different levels the body structures are studied as slices. So near the neck or below the neck and below. So we can see lung and heart and also mediastinal structures. This is another film of CT scan of the chest. You can see from the upper level to the lower levels. You can see near the neck and below. Okay. So structures of lungs, heart, and the abdomen also it is seen. Okay. You should know prior knowledge of anatomical configuration of the body is necessary to detect the pathology of the body organs in CT scan. You should know the principles of X-ray also and tomography, and also you should know the anatomy perfect, so that you can assess the type of abnormality and extent of damage. You can see the female patient, you can see the lungs, the both lungs and the heart and the blood vessels, they are visualized. This is a film of CT scan of the chest at different levels. You can see lung shadow and heart and blood vessels and thoracic cage, thoracic wall. The other CT scan of the body, of the chest, where you can see the shadows of lungs, heart, blood vessels, and the thoracic cage. In the computer screen, you can see at different levels the tomography. This is a tomography film where you can see the body parts at different levels. So the structures such as lungs, heart, blood vessels, and thoracic wall is seen. The muscles and the you can see in this X-ray also and CT also. This is a film with the tomography at different levels, starting near the neck and below the neck, chest, abdomen. You can see the structures. You can study the film. Structures like as lungs, heart, mediastinal structures, and abdominal structures are visualized. You can suppose some pathology is seen, some lesion is seen, you can measure the size of the lesion also. This is in the frontal plane, the scan in the frontal plane. You can see the different organs by CT scan. This is a CT scan of the chest. You can visualize the heart, lungs, bronchioles, bronchi, and the chest wall. The other film which shows CT scanning of the chest. You can see the thoracic wall, the lungs, and the heart. You can see arrow mark shows a lesion. That is a round lesion is there, and there is increased whitish area is there. That may be a tumor. This is a film containing the CT scan pictures, the chest, you can see lungs, heart, and thoracic cage. You can visualize bronchioles. Another film where you can see the tomographic structures, tomographic of the chest. You can see so the lungs, heart, the wall, thoracic wall. This is the frontal plane. You can see the X-ray, sorry, tomography. Another film of tomographic study where you can see the film, the structures such as lungs, heart, mediastinal structures, and the wall. The doctor is pointing the pathology in the lungs in tomographic study. The other film shows the tomographic pattern, the tomographic study. So we can visualize the heart, blood vessels, lungs, and thoracic cage. The other tomographic study where you can visualize the structures. So at different levels we can visualize. The abdomen also some structures. This is a film which contains the tomographic pattern of tomography of the chest at different levels. Here you can see the heart size also, and in the right side lowest the film of the chest is there, where the lungs contain some haziness that can result in condition or pain. Here the bronchography is pattern of bronchial tree. Here you can see some business in the lung parenchyma. There can be some collection of mucus. Here you can see blood vessels and the tributaries. You can inject a radiopaque dye in the bloodstream, and you can visualize the pattern of the blood vessels. The film contains the tomographic picture of the chest. You can see heart, lungs, and thoracic wall. Another film which contains tomography of the chest. Today, we have discussed the CT scan of the chest. Usually, X-ray is done to study the pathology. For example, pneumonitis, tuberculosis, or mediastinal pathologies, cardiomegaly, heart pathologies, all they are seen by X-ray, simple chest X-ray behavior. But in goes into assess the further study, like mediastinal pathologies or some bronchogenic carcinoma or secondaries in the lungs, we can go for CT scan. CT scan is faster than X-ray. So first X-ray is done to finalize the decision. We can take the help of CT scan. Thank you for patient hearing.